What is Austedo? Austedo and Austedo XR deutetrabenazine are used to treat chorea, sudden involuntary movements caused by Huntington's disease, an inherited disease that causes the progressive breakdown of nerve cells in the brain. Deutetrabenazine is not a cure for Huntington's disease and will not treat other symptoms of this condition. Austedo is also used in adults to treat symptoms of tardive dyskinesia (TD), a nervous system disorder. Tardive dyskinesia causes repetitive, uncontrolled muscle movements, usually in the face, chewing, lip smacking, frowning, tongue movement, blinking, or eye movement. Austedo belongs to a class of medications called vesicular monoamine transporter 2 VMAT2 inhibitors. It works by changing the activity of certain natural substances in the brain that affect nerves and muscles. Austedo is taken twice daily, and Austedo XR extended release tablet is taken once daily. How does Austedo work? Body movement or motor function is controlled in the brain by nerve cells, neurons that speak to each other by passing chemical messengers, neurotransmitters, from one nerve cell to another nerve cell. In movement disorders such as Huntington's disease and tardive dyskinesia, there can be a problem with this system. And by lowering the amount of chemical messengers between the nerve cells, you relieve the uncontrolled movements. A protein called VMAT2 controls how much chemical messenger is stored in the nerve cell and how much is released. The VMAT2 inhibitors block VMAT2, which means there is a lower amount of neurotransmitter available, and therefore reduces the unwanted body movements. Before taking this medicine, you should not use Austedo if you are allergic to deutetrabenazine, or if you have untreated or uncontrolled depression, thoughts about suicide, or hurting yourself if you have recently taken tetrabenazine or valbenazine or liver disease. Do not use Austedo if you have taken reserpine in the past 20 days, or if you have used an MAO inhibitor in the past 14 days. Austedo dosing information: initial dose 6 mg twice daily, 12 mg per day. Dose titration may increase dose in increments of 6 mg day at weekly intervals, based on reduction of chorea or tardive dyskinesia, and tolerability up to a maximum of 48 mg day in divided doses. Maximum dose 48 mg day in divided doses. Important administration instructions: take Austedo with food, swallow whole. Do not chew, crush, or break tablets. Take Austedo total daily dosages of 12 mg or above in 2 divided doses. Austedo XR dosing information: initial dose 12 mg once daily, 12 mg per day. Dose titration may increase dose in increments of 6 mg day at weekly intervals, based on reduction of chorea or tardive dyskinesia, and tolerability up to a maximum of 48 mg day. Maximum dose 48 mg day. Important administration instructions: take XR tablets with or without food, swallow whole. Do not chew, crush, or break tablets. Take Austedo XR once daily. Switching between Austedo and Austedo XR: when switching between Austedo tablets twice daily and Austedo XR extended release tablets once daily, switch to the same total daily dosage. Austedo side effects: get emergency medical help if you have signs of an allergic reaction to Austedo, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Some people have thoughts about suicide while taking Austedo. Stay alert to changes in your mood or symptoms. Your family or caregivers should also watch for sudden changes in your behavior. Some side effects may actually be signs that your Huntington's disease is progressing. Your doctor will need to check your progress on a regular basis.